Do you know what anorexia is? Anorexia nervosa is a psychological and possibly life-threatening eating disorder, defined by an extremely low body weight relative to stature, extreme and needless weight loss, illogical fear of weight gain, and distorted perception of self-image and body. Statistics for this diseases are: 1 in 5 women struggle with anorexia. An estimated 10 to 15% of people with anorexia are male. 90% of those who have eating disorders are women between the ages of 12 and 25. 5 to 10% of anorexics die within 10 years of onset. 18 to 20% die within 20 years of onset, and only 50% report ever being cured. There are 2 major types of anorexia, which are anorexia nervosa binge, and restrictive anorexia nervosa. The individual suffering from anorexia nervosa binge will purge when he or she eats. This is typically a result of the overwhelming feelings of guilt a sufferer would experience in relation to eating. They compensate by vomiting, abusing laxatives, or excessively exercising. In restrictive anorexia nervosa, the individual will fiercely limit the quantity of food consumed, characteristically ingesting a minimal amount that is well below their body's caloric needs, effectively slowly starving him or herself. The causes can be divided into environmental factors and biological factors. Examples of environmental factors that would contribute to the occurrence of anorexia nervosa are the effects of the thinness culture in media, that constantly reinforce thin people as ideal stereotypes, and professions and careers that promotes being thin and weight loss, such as ballet and modeling. Next, family and childhood traumas, such as childhood sexual abuse, severe trauma, and also peer pressure among friends and co-workers to be thin or be sexy. For the biological factors, the examples are irregular hormone functions, genetics, and nutritional deficiencies. Do you know the signs and symptoms of anorexia nervosa? The diagnosis for anorexia are physical exam, lab test, and psychological evaluation. For physical exam, this may include measuring your height and weight, checking your vital sign, your skin and nails problems, listening to your heart and lungs, and examining your abdomen. For the lab test, these may include a complete blood count and more specialized blood tests and functioning of your liver, kidney, and thyroid. A urinalysis also may be done. For psychological evaluation, a doctor will likely ask about your thoughts, feelings, and eating habits. You may also be asked to complete psychological self-assessment questionnaires. The effects of anorexia are career disruption, heart attack, infertility, brain damage, shutdown of major body systems, and death. In medical, the highest priority in the treatment of anorexia nervosa is addressing any serious health issues that may have resulted from malnutrition. For nutritional, this component encompasses weight restoration, implementation and supervision of a tailored meal plan, and education about normal eating patterns. In therapy, the goal of this part is to recognize underlying issues associated with the eating disorder, address and heal from traumatic life events, learn healthier coping skills, and further develop the capacity to express and deal with emotions. Anorexia can be fatal. Don't ignore the signs. You can educate people that eating disorders are not a lifestyle, and end the stereotypes once and for all. In conclusion, you don't have to starve yourself to be gorgeous. Beauty comes in all shapes and sizes. Love yourself enough to live a healthy lifestyle. Don't let your mind bully your body.
Free created using Powtoon.